Akwesasne and the rest of the Seaway Valley, good afternoon and welcome to a live edition of CKON Wednesday to Untitled. My name is Reen Cook, and we're glad to be with you on this Tuesday afternoon. Original air date of the program live is Tuesday, August 31st, 2021. And we remind you, views and opinions expressed by our guests and our callers during Untitled Chapter, not necessarily those of 97.3 CKON or the Akwesasne Communication Society. And our phone lines are open. We will take questions for our guest today. I do ask that you take a listen to his presentation, and then I will address any questions that are coming in during the program at 518-358-3427, 613-575-2101. I'd like to remind you that this program is on Facebook Live under the Mohawk Council of Akwesasne's Facebook page. But again, if you need to get your question through to the Grand Chief, you have to call the radio station to get that on for us, okay? So we appreciate everybody tuning in today. And we're going to welcome back to the airwaves Mohawk Council of Akwesasne Grand Chief Abram Benedict. We're going to talk about the COVID-19 update, vaccine passports, and also orientation of the brand new term of council for the Mohawk Council of Akwesasne with the district chiefs and also with the Grand Chief. So we'll talk about that orientation too. So with that, we are going to welcome to the program Mohawk Council of Akwesasne Grand Chief Abram Benedict. Sego and welcome, Grand Chief.
Sego and good afternoon, Reen. I hope you and all of our listeners are doing well this afternoon. As always, I'm going to go to Reen and CKON for the opportunity to update you in the community today. This afternoon, as Reen mentioned, we'll be providing an update on the MCA's COVID vaccination. We'll touch on vaccine passport, as well as I'll provide an update on our council orientation schedule and sessions. I do want to take a moment to acknowledge everyone for everything that they have done during this pandemic. While things have changed quite a bit, restrictions have loosened, we must continue to exercise caution. Regardless of what the directives are, we need to continue to be smart and stay safe. The pandemic is not over. In fact, unfortunately, we're seeing a slight rise in cases around us. The Delta variant is the major contributor to the new cases, and data is showing that the new cases are generally around individuals of 20 to 39 years of age. It's extremely important that we all get vaccinated to keep ourselves and our most vulnerable safe. The Mohawk Council of Akwesasne continues to offer vaccine clinics by appointment every Wednesday at Akwesasne. You can call the community health at 613-575-2348 to book an appointment. These Wednesday appointments rotate between administering Moderna and Pfizer. Therefore, you are able to receive one or the other of the vaccines. We encourage you to call community health to discuss and book your appointment. The St. Regis Mohawk Tribe continues to offer walk-in clinics every Wednesday to all members of the community. As of last week, the Mohawk Council of Akwesasne has administered 2,314 vaccines to our community members. The St. Regis Mohawk Tribe is reporting administering 7,778 vaccines. Yangagoa to all of those of you that have been vaccinated. I want to remind the community that having received quarantine orders or suspect direct contact with a positive case, please remain at home and do not travel. Early symptoms include diarrhea, fever, cough, tiredness, or possible loss of taste or smell. Both the St. Regis Mohawk Tribe and the Mohawk Council of Akwesasne continue to offer COVID-19 testing. If you suspect you have COVID-19, please make an appointment to be tested. Since the beginning of the pandemic, and as it continues today, it's extremely important that if you feel sick or have tested positive for COVID-19, that you remain at home and isolate. Spreading COVID-19 to others will only cause harm and will result in a possible community outbreak. We don't want to see the re-implementation of additional restrictions, so we must all continue to do our part. Last Thursday, I joined a panel here on CKON to discuss the COVID-19 vaccine with Chief Beverly Cook, Dr. Horn, and Dr. Ben Kelly. We shared important information on the vaccine's effectiveness and safeness. This show was streamed on our MCA Facebook page, and the entire recording can be found on our MCA Facebook page as well. I encourage those who wish to learn more about the medical side of the vaccine and its effectiveness to listen in on the recording. The best way to protect ourselves, our elders, and our children is to get vaccinated. We want you to make an informed decision. I would now like to share some information with the community on the ongoing discussions on vaccine passports. These discussions have been happening in many provinces, including Ontario and Quebec. The vaccine passport is essentially official proof that you have your immunization. And this would be required to attend certain function or places that are not essential. Starting tomorrow, September 1st, the province of Quebec is requiring vaccination proof from visitors and residents of Quebec. This includes Akwesasne members who are planning on visiting Quebec for non-essential activities. If you're planning on attending a festival, concert, movie theater, bars, restaurants, outdoor events, theme parks, or sporting events in the province of Quebec, you will be required to show your official vaccination receipt or proof of vaccination. Currently, Ontario has not implemented the vaccine passport, but there continues to be ongoing discussions at the Government of Ontario level about the possible implementation of a vaccine passport. Remember, these requirements could change at any time. Currently in Akwesasne, we continue to encourage our members to get vaccinated. We don't have any plans at this time to develop a vaccine passport in Akwesasne, but places outside of Akwesasne may continue to implement these requirements. To be clear, a vaccine passport is proof of vaccination. Finally, since our council's last swearing in as of July 9th, our council has been involved in several MCA Department of Program orientation sessions. These sessions are an opportunity for council to learn more about the MCA programs and the departmental political needs. We have also participated in 2 governance leadership workshops with the Aboriginal Financial Officers Association, also known as AFOA. Other workshops and training sessions are planned in the coming weeks, including our strategic planning. On August 5th, our council hosted our first general meeting. The agenda included a roundtable introduction of members of council and a PowerPoint presentation of our orientation schedule. The first district meetings were held last week. Our next general meeting will take place on September 23rd, and we will be using the Zoom platform. You can email meetings@akwesasne.ca for the link for the district and/or general meetings. The links are sent out on the day of the meeting. Right now, all of our general and district meetings are occurring on Zoom. We continue to reevaluate this decision regularly, taking into consideration the health and safety of our community. Reen, that is all I wanted to cover this afternoon by the way of my update. As always, I am open to take questions from you and our listeners on this report or any other items we wish to discuss. Yeah.
So, Grand Chief, couple of questions off the top. Do you know the logistics of the vaccine passport? Do we have something on our phone? Does Quebec have an app that we can download? Do we need printed a vaccine card information? How does that all work? And if you don't have the information, where can we find it?
Yeah, so the Quebec is requiring proof. They do have an app. But because our vaccines weren't done by the province of Quebec, we're not able to register for that app. Essentially what that app is that they will take their receipt that they've gotten, put it into the application on their phone, and it will generate like a barcode that would be then scanned by the businesses or events that the individual wants to attend. That would be how that system works. But what they will take is just the official receipt that's been provided to you of your vaccination. The scanning part and then the app part is more of make it a bit faster of a process. But unfortunately, because our vaccines are not part of the Quebec system, we're not able to use that app.
Okay. Now, what about Kahnawake? Have you had any talks with their Grand Chief or any of their elected representatives, or they've been very adamant with regards to their COVID response and continue to be? So are they requiring anything in their community since Quebec is requiring it in the province?
Yes, I understand that yesterday their council released information that they are implementing a very similar, if not the same as Quebec, a vaccine passport. So in order to attend restaurants and establishments there in Kahnawake, you will be required to show proof of vaccination. Now, I don't know the exact implementation date, but it is something that their council is moving towards.
Do you think they're doing that just because they're so close to Montreal and they have so many people coming from the city onto their territory? Is that why they're doing it, or is that what have you heard?
Well, so the vaccine passport has been really developed by the government as a way to ensure that individuals going into businesses and using services are vaccinated. So it's really the design of the vaccine passport is a bit of an economic side to it, so that individuals who are doing non-essential activities, i.e. going to restaurants, going to concerts, what have you, are vaccinated. So it's a system to track. So the economy is a bit different in Kahnawake. They do have, a few areas that are highly visited by people from outside of the community. So, that's ultimately their decision if they want to implement some sort of system, and they have, indicated they're going forward with a vaccine passport system in their community for individuals to be able to attend, businesses and functions within their community.
All right. So again, we're talking with MCA Grand Chief Abram Benedict. If you have a question for the Grand Chief, by all means, give us a call here at the radio station, and we'll be glad to ask that question for you. Now, regarding that vaccine passport in Quebec, that covers hospitals as well. Like if we have people that are in the hospital there or are going to be visiting patients or dropping patients off and things like that, they have to be vaccinated as well. That would count for being in Quebec.
Well, so the functions of that are covered are non-essential. So if you have to go into a hospital for a procedure for a fall, that's an essential. Therefore, you're not required to show proof, but there may be a requirement from the hospital to visit. I think visiting, they may classify as not being an essential activity. So if you're going in, you may be required to show proof. But if you are attending a physician, a hospital, a service that is deemed necessary, then you won't be required to show your vaccination proof.
Okay. Let's go back to the orientation for the Chiefs. With the new term upon us, have they chosen their portfolios yet?
Yes, the portfolios have been chosen. They have not been ratified yet by council. It's expected that they'll be ratified on Friday. Unfortunately, our council generally meets on Mondays. We weren't able to meet yesterday, as we had unfortunately a prolonged power outage. Therefore, we've rescheduled it to Friday. So after Friday, we should have the official listings of the portfolios for our council.
Excellent. Nice to have you back. And talking about our district chiefs and the portfolios, we had mentioned that those will be ratified at this Friday's council meeting. And also looking for that list to be made public on the MCA Facebook page. I know some of the district chiefs have also created some Facebook pages for their districts overall. Grand Chief, did each district make a Facebook page for their district chiefs to interact with the community?
I believe 2 of the districts have as of right now. The Akwesasne and Ganaldigo chiefs have. I'm not sure if the Gawanoga chiefs have planned as well, but they'll be sharing information and updates to the community on each of those Facebook pages.
Perfect. So we talked about the fact that some offices and locations and buildings have been rearranged within MCA structure throughout the COVID-19 pandemic. So again, Grand Chief, I'll ask you for the district chiefs and the Grand Chief, where are your offices located physically, and how would we reach out to the Grand Chief or district chief directly?
Mm-hmm. So the members of council are working from home. There is a space here at Min 1, which is the A-frame building, where they do work here on a rotating basis. If they want to meet community members, there is space here as well, but there isn't 13 offices here for our members of council, unfortunately. So they do have the work from home. Now, in order to contact them, it's either by email or by their cell phones or by calling any one of the Mohawk Council of Akwesasne main numbers, and asking for the district member. They will then be patched right over to them directly.
Okay. So looking at the food, I know that we've still got some food distributions that are scheduled. Is that going to be continuing on a regular basis, or how has that been working out with the food distribution through the Mohawk Council of Akwesasne?
We still do continue to have the food pantry on Cornwall Island. It is you have to call ahead. I believe it's every 2 to 3 weeks that they are doing that. That is done through our DCSS program, which is a Department of Community Social Services. As well, that's being distributed from what used to be known as the group home on Cornwall Island, which is around AMS. That is the pickup site. They do have one in Akwesasne as well, but the food pantry project will be continuing for the foreseeable future.
All right, now looking at the Mohawk Council of Akwesasne as an organization, one of our biggest employers here in the territory of Akwesasne is the Mohawk Council of Akwesasne considering looking at mandates for the COVID-19 vaccine for their employees.
Currently, right now, there was a ministry directive that said that all healthcare workers needed to be vaccinated. So council has adopted that directive. So all of the Department of Health staff have to be vaccinated. Now, if they're not vaccinated, there is an opportunity for them to get vaccinated. If they choose to still continue to be not vaccinated, then they'll be tested weekly for COVID-19.
All right, so they have a choice whether to get vaccinated, or the other opportunity is to be tested weekly. So that is available for individuals that are the healthcare workers under MCA's Department of Health for Holistic Health and Wellness. All right, so again, if you have a question for the Grand Chief, Mohawk Council of Akwesasne, Abram Benedict, give us a call here at the radio station at 613-575-2101 or 613-575-2100 and 518-358-3427. So you alluded to it when you mentioned that yesterday's council meeting had to be canceled because of the prolonged power outage, Grand Chief. What are we doing with Hydro-Quebec? How are we dealing with that? Is that something that the new council is going to be taking on in a more concerted effort regarding why we always have all of these different, we can rectify that?
Yeah, so this has continued to be an ongoing issue for our community. We actually just had a meeting last week with Quebec Hydro to talk about Akwesasne's energy stability and longevity of going forward. So we have received a presentation from them, and more of a technical presentation to better understand where the main what they call this transfer station is that feeds into our community, and then making its way down into our community. As well, they have provided us with an update on their vegetation mitigation, which means that they're all making sure that the lines are cleared of trees and bushes, what have you. That work, they have told us, will begin next year. We've put an emphasis, well, we've asked them and put a lot of pressure on them to move this work up, so they are looking at what those opportunities are. The unfortunate part is that our line that runs into our community is the end of their line, and it's not while we're a large community base, they have lots of customers that are outside of our area. So it is a bit of a challenge there. What we have asked them to do is examine alternative sources or alternative areas that they can bring the power in. Now, I understand that there used to be a power connection that connected from New York into our community. This is something that we've asked them to look at because the biggest challenge is that the distance from the transfer station to essentially the end of Sny is quite a distance, and in fact, from the end of Sny to the nearest point in Dundee is quite far itself. So that area, is challenging because it's in the woods or in the swamp. But so we are aggressively pursuing all other options for energy, for reliable electricity in our community. Now, we'll continue to keep the community updated on this as it goes forward. We also are looking at alternative connections without Hydro-Quebec involved. So we are actively looking at what some of these would be. Now, understanding though that, if we were to do a project on our own, this will require an investment by the community. Now, I don't doubt for one second that having reliable power is a good investment, but we also want to make sure that those entities, Quebec Hydro, is doing their part to make sure that we have reliable electricity. So there is a multi-pronged approach happening on this, and we'll keep the community updated.
Has there been any talk about working with National Grid? I mean, there are power poles, 400 feet from Ganuncotaleo that are American side power poles. Has that been something that has been looked at or even talked about?
We've asked them in our last meeting to examine that option because it seems quite viable. It's, literally can be a few feet from each other in a connection, but it's not all that easy from a technical perspective. But it is something we've asked them to examine, and we're going to do that on our own as well, examine that.
So do we have a consultant that we brought in for ourselves, or are we depending on Hydro-Quebec to look into these things and to help us?
As of right now, it's relying on Hydro-Quebec for some of the technical information from their perspective. They do have, the engineers and experts. We've asked them to share those reports with us so that we can validate what some of their positions are. But if, as we move down this way, we will look at the possibility of bringing in our own consultant. I will tell you though that there are a number of studies that we have done in our community on, one electrical grid for the entire community, meaning the northern and southern portion. There is a few studies that we have done on alternative energy. So we'll be pulling some of these reports back out as well and not trying to reinvent the wheel in certain places.
Okay. Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. We're talking with his monthly update. And if you have any questions for the Grand Chief, you can give us a call here at the radio station. We are talking to him by telephone now. We did have some issues with the connectivity on the Grand Chief and being able to be on Zoom and present that on the MCA Facebook page. So we have gone to the telephone. As we continue to talk about yesterday's big power outage, there was some talk, or I don't know if I saw something officially on Facebook with regards to surveys or information that was being collected from community members about losses because of the power. Whether the power surge caused a refrigerator to be lost, or a television set, or refrigerators and freezers, the spoiling of food. Meat is very expensive to lose during these extended power outages. So can you tell me what that's about and where that information is going? Is that something that is to the Hydro-Quebec officials, and are there ways to recoup our losses as community members? Who's going to pay for that?
Yeah, so just so you know as well, we still are streaming on the Facebook page. I just have my phone close to my microphone, and it is being picked up
Okay.
on Facebook as well. As we've set it up, we've improvised. But on your question about the survey, the council identified a Chiefs Committee to work on the hydro sustainability with Quebec Hydro file. Those members of council have asked the community to provide them with more detailed information in regards to some of the losses or damages occurred by either flickering of power or the fact of having power outages for a long period of time. While we do know that, unfortunately, some electronic appliances have, been damaged. We do know that individuals have lost, some food or what have you in the fridge or freezer. They want a bit more of those details on that. Now, we will take back some of this information and analyze and see what other venues or other options may be available to us to help either further why we need more sustainable electricity, or maybe compensation. But this is just, it's a bit of a fact finding right now to get more data from the community.
All right, question with regards to manhole covers, sewage drains. The caller wants to know, why are they not cleaning the covers in Sny? The rain is causing flooding in neighborhoods. I asked 3 years ago and still no one cleaned them. So do you have information on that?
Yeah, I would ask them to reach out to our roads department under the Department of Infrastructure, Housing and Environment, which is headed by Lorraine Bova. She's the director there, to give them a call, but I can follow up as well. I know that there's not a lot of areas in the community that have manhole covers or drain covers, but that we can get somebody to go look after this. I know that we've been having a lot of flooding issues in many parts of the community. We are looking at engaging a professional in water levels, in water tables within the District of Sny to be able to look at what some mitigation measures may be for flooding in the District of Sny. So just a bit on that, the drainage and stuff like that. It continues to be an issue in the District of Sny, as well as in other parts of the community, because we're not getting regular rainfalls. We're getting mass amounts of rain falling at a very, for a very sudden and for a very short period of time, which is causing, a lot more flooding, because the design has been made that it slowly, tapers off, not buckets of rain. So, but I will ask the department to follow up, and if they could follow up with a call to the department as well, that'd be helpful.
All right, let's go back to the vaccination. This caller says MCA, Grand Chief, and Council are pushing for members to get vaccinated. And the question is, what will MCA do to take responsibility if a fallout happens if the vaccines don't work?
Mm-hmm. Well, I mean, our show last, our update with yourself, Reen, and Dr. Horn and Dr. Kelly was about providing, the medical side, the science side of the vaccines. So thus far, it's shown that, the vaccines are anywhere from 92 to 95% effective, and that's the Pfizer and Moderna vaccines for individuals, seeking to be protected from the COVID-19 virus. As a community, we want to be safe. We have a lot of vulnerability in our community. Unfortunately, the design or the current phase of the vaccines, if you're 12 and under, or children 12 and under are not able to get the vaccine, therefore they are vulnerable. Our elders are vulnerable because of their age and could possibly be underlying health conditions. So it's important that individuals read up on from creditable sites or speak to our community doctors here to learn more about the vaccine. But so far there hasn't been any data to say that the vaccines are not effective. Now, they're not 100% effective, but they are, right up there in the 90% percentile of being effective.
And another caller, they are asking why are some employees, and they're allegating there's allegations of bullying other MCA employees to get vaccinated. Is this right or legal? And this caller says it feels like harassment.
Well, for the community health department as a whole, there has been a directive for the staff to be vaccinated. Now, if they're not vaccinated, there is a process that will be followed whereby they will be tested regularly. They will also have to participate in informational sessions on the risks and benefits of not being vaccinated or being vaccinated. This is administrative as far as the implementation part of the directive for vaccination, but we are a community government, community service provider that provides a service to our community, and people rely on us for services to be provided to them. And we want us as a community government, us as a service provider, to be providing safe service to our community as much as possible, and being vaccinated is one of those ways. Now, it's if people feel that they're being bullied into it or being intimidated, there is a harassment and bullying policy in the MCA, and there's a process for them to follow. And I would suggest that they, follow up on those venues made available to them. We are in this together, and we have said that from day one. And intimidating and bullying people to get vaccinated is not being in this together.
And let's go back to the power. Why doesn't Mohawk Council of Akwesasne have generators at their offices in Quebec and covering Siverages and Snai? Why aren't there generators? This has been an ongoing problem for years. And why haven't we purchased generators yet?
Well, it is something that some of the buildings is in the planning. Some already have it. A few of our facilities have it already to provide some electrical supports while in an outage. I think that ultimately this comes down to costs as well. And we have to look at what the cost is of putting generator systems in all of our facilities. Unfortunately, the way the MCA is set out, we don't have, two big office buildings. We have several small buildings throughout the community, which then means that we have to have several systems to support them. Now, it doesn't mean it's impossible, but it is also financial as well. We look at long-term what some of these plans may be, and we're still exploring what these causes are of the outages. If we're able to solve or mitigate and lessen the outages through partnership with Quebec Hydro or a partnership with another supplier, and we have to make investment there, that may be a better investment than several individual generators. But it is something going forward we'll continue to look at.
All right, so another question, let's go back to the vaccination. Why are you not bringing in an alternative to the vaccines for those who can't or choose not to take those two options? I must be referring to your Ministry of Health directive and having to have those that work in your health department vaccinated or tested weekly.
Well, I mean, I don't know. There isn't a whole lot of other options to be vaccinated. That's been, scientifically and studied and proven that, the safest way to keep yourself and our community safe is to do, something else. That's not, been published or put out there. So, I mean, as a provider to the community, as a service provider, we want to make sure that people are safe. There is a process whereby if individuals are not vaccinated, that they will again have to be tested. That's the downside of not being tested. But again, we have a number of employees in our organization that we can't have an outbreak in our community as contributed to people that don't want to be vaccinated or congregating of people who are not vaccinated, right? So there's a lot of risk factors that we have to consider on this. to make sure that we're doing the best we can to keep people safe. Now, if people are not comfortable with it, there are, again, like we said last Thursday with Dr. Horn and Dr. Kelly, they are available to talk to individuals one-on-one about the vaccines, to talk more about what's in it, what some side effects could be, what things to expect are. But I would say that for the most part, we're doing pretty good on vaccinating. Now, Canada has said that all the indicators are there that we are in a fourth wave at this point, and all of the data shows that the fourth wave is being made up of people who are not vaccinated. So we've all spent a lot of time in lockdowns. We've spent a lot of time away from families, and we don't want to do this again. So preventing a fourth wave that has implications to us in our community is really what we want to do, so that we don't have to go through what we did earlier on in the pandemic.
Another question, is the Grand Chief aware of studies coming out of Israel that show those who contracted COVID-19 are 13 times more resistant to the Delta variant than those who are vaccinated due to natural immunity?
No, I'm not aware of the studies coming out of Israel. I can only go on what the studies here that are being shared by our health professionals. But I think that the demographics, the infrastructure, the culture, the environmental factors in Israel are probably quite a bit different than they are in North America, and even more specifically to us as Ungahua people, that us as Indigenous people are higher risk, and we have to make sure that we're doing our part in this part of Turtle Island to keep ourselves safe.
All right, again, we're talking with Grand Chief of the Mohawk Council of Akwesasne, Abram Benedict. I'm going to wrap things up at 1:15 at the latest. Anything we don't get to for the Grand Chief, I will make sure the communications unit has that and is aware of what the community is asking and thinking about. So last chance to get your calls in for the Grand Chief. So looking at the vaccine and with the Siverages Mohawk tribe, again, offering incentives for individuals from Akwesasne to get vaccinated. If they go get their first shot, they get $100 in casino dollars, if you will. And then if they get their second shot, again, they get $100 worth of money from the Akwesasne Mohawk Casino in way of a gift card. And then their name also goes into a draw for $1,000 cash prizes as well. As the Mohawk Council of Akwesasne thought about or going to be incorporating any financial incentives for individuals to receive the vaccine under MCA.
So this is we've continuously talked about this since vaccine rollout began. We continue to look at the cons and pros about this. Thus far, our council has determined that doing a an incentive program to be vaccinated is not something that we want to entertain. Will it change in the future? I'm not sure, but at this point in time, we're not considering the implementation of any incentive programs.
All right, now looking at the evaluation process, I know that this is on the administrative portion of MCA. The evaluation process for the executive director, how does that process work?
There is, like any employee, there is a process whereby a PREA is formulated by the employee, and then a committee of council will review that and make the performance evaluations.
And with regards to the executive director, is council that person's supervisor? How does that work? Colin wants to know.
Yeah, council as a whole is the executive director supervisor, not by individual chiefs, though it's by collective.
Okay. So again, talking with the Grand Chief of the Mohawk Council of Akwesasne, looking at the Akwesasne Mohawk Police Service. I know in one of your council meeting updates, there was information with regards to Akwesasne Mohawk Police Service. I guess contacting them by the chiefs, finding out about jurisdictional high-speed chases and how that process works, and I guess how that all works into it. So asking questions about AMPs and information they provide on high-speed chases with different jurisdictions.
So the Akwesasne Mohawk Police Services has a no pursuit policy, which means that if somebody is failing to stop or takes off, they won't engage in a high speed pursuit with them in our community, because the fact that we have the international border, which results in two police forces of jurisdiction. We have been in various talks with the tribe to make sure that our police forces are working closely together in case of those over the border pursuits, to make sure that they're communicating and that they are working together to either stop the individual or track down the individual so that they can later on be held accountable for their actions. But the Akwesasne Mohawk Police Service has a no pursuit policy as of right now.
And when does the police commission meet?
I believe the police commission meets every month. They do have appointed members of the district who are commissioners, and there are 6 of them. I don't have the names off of hand, but they can be found on the MCA website. If individuals want to know their names, they can reach out to my office or one of the members of council, and we can provide that to them. I do know that the police commission chair is Gary Cole at this time.
All right, so let's go to the schools. Akwesasne Mohawk Board of Education, district schools, they're going to be having their mandatory orientation this Friday with the district schools. Now, how do we refresh our memory? I know that we went through some shutdowns with regards to the schools and went to, over online